Functional Electrical Stimulation, or FES, is a fantastic technology that uses small electrical impulses to stimulate muscles that have become weak or inactive due to neurological damage in order to perform a functional task. Its most common application is to correct foot drop, to improve walking and reduce trips and falls. And this has been life-changing for many of our clients. But how do you know if FES is right for you? Before trying out FES, there are a few medical considerations. FES may not be suitable for people with cardiac pacemakers or other medical devices under the skin, epilepsy, or broken skin at the site of electrode placement. We'll always go through a full clinical screening to make sure it's safe for you. FES is most effective for people with damage to the central nervous system. That includes conditions like stroke, multiple sclerosis, cerebral palsy, incomplete spinal cord injury, and brain injury. That's because the electrical signal bypasses the damaged area of the brain or spinal cord and goes directly to the muscle. But if the peripheral nerve, that's the final part of the nerve that connects the spinal cord to the muscle, is severely damaged or completely lost, then the electrical signal can't activate the muscle. Peripheral nerve injuries resulting in foot drop are often caused by cauda syndrome, back surgery, or other trauma or compression. It is highly unlikely that FES will help in these cases. There are rare exceptions in partial peripheral nerve injuries where there is a loss of feeling in the leg but some strength is preserved. FES might still bring benefit by helping coordinate a timely foot lift when walking. We're always happy to assess your suitability. The primary role of FES is to compensate for foot drop. When wearing FES, many people walk faster using less energy. They reduce trips and falls and report increased confidence and a better quality of life. Compared to other options, there are lots of benefits of FES. You can wear normal size shoes. Often people may rely on an ankle-foot orthosis, also called an AFO or a splint, to correct their foot drop, and these will regularly need larger shoe sizes. Complete freedom of movement at the ankle. So your ankle and the muscles around it get the chance to move more freely. Conditioning of weak muscles. FES optimizes muscle strength and efficiency. Loosening of tight muscles. Often the calf muscle can get tight due to lack of movement and/or spasticity. FES stimulates a natural reflex that relaxes the calf. Improves circulation, so FES may result in reduced swelling. Increased sensory stimulation of the leg, so you may feel more aware of the leg and the foot. While there is less evidence about the ability of FES to promote recovery, we are in no doubt that it provides a more dynamic solution that gives the brain and muscles a better chance to relearn lost movement patterns. For many people, it becomes part of a wider rehab program, not just a walking aid. However, there are limitations to FES. You need enough flexibility in the ankle and calf muscle for it to work. If you can stand upright in your bare feet with your heel touching the ground, that should be enough. Sometimes it's not strong enough to overcome calf spasticity. If you have severe spasticity or clonus where your heel bounces, you might need to address this before FES can be effective. Some people can find the sensation uncomfortable, and sometimes the skin can become irritated and inflamed. There may be less ankle stability compared to using an ankle-foot orthosis, so it could be less suitable for walking on steep slopes or uneven ground. Its effect may vary with other factors such as fatigue, spasticity, and how the stimulation is triggered. Swelling. So if you have very swollen legs, FES might have difficulty getting deep enough to stimulate the foot to lift. So to summarise so far, you are a good candidate for FES if you have a foot drop caused by damage to your central nervous system, enough flexibility in the ankle to stand barefoot with the heel down, moderate to low levels of spasticity, a stable ankle in standing, no severe leg swelling, and obviously no contraindications. If this isn't you, don't worry, there are alternatives to FES that many people find helpful. An ankle-foot orthosis might be a better solution for you. These are often provided by an NHS orthotist, but we also have some lighter weight carbon fibre options that fit in normal shoes. Often FES users will also use an AFO some days to give their skin a rest. There are also less structured ankle braces, supportive socks or taping techniques which may help in milder cases. We can help you weigh the pros and cons of each option. We hope that's been a helpful introduction to FES for foot drop. If you think FES might help you or someone you know, the next step is to book an FES assessment. Give us a call, drop us an email, and we'll schedule something in. We look forward to meeting you.